and I'm the Headstart Hull Programme Manager. And what I'm going to be talking about today is delivering systems change to improve outcomes for children, young people and families on mental health. I'm going to give you a little bit of a whistle-stop tour through Headstart Hull so you have the context to what I'm talking about, how we evidenced improving outcomes for children and young people, a bit about the challenges and the successes of delivering that system change, and then a bit about how that has enabled us to make adaptations for COVID. So when we first started the Headstart journey, feels like a long time now. Headstart, the National Lottery approached us at a time when we were really reviewing the work we were doing in Hull around children and young people's mental health. I think it's fair to say we'd had we had CAMS and we had some crisis interventions, but we hadn't really had a comprehensive citywide approach to prevention and early intervention. And Headstart really gave us the opportunity to do that. So one of the things we first developed was our mission statement, and this was co-produced with young people, parents, and a whole range of partners, because right from the very beginning, we wanted this to be a dialogue, we wanted it to truly represent need, and we didn't want it to be something that was imposed, but rather continue to be developed through a test and learn model with our partners. So our mission statement was around enabling young people to have positive mental health and well-being, very much taking an asset-based approach where, as one young person said when we were developing this, we tended to take a more negative approach. So a young person said to me, with physical health, you talk about how to keep well, how to eat 5 a day, how to stay active, and then when you talk about mental health, you only talk about mental illness. We wanted young people to thrive in their communities and to bounce back from life's challenges. So this wasn't saying that Headstart and the work around prevention and early intervention could prevent any poor mental health, but we know a lot of young people will face various challenges as they grow up, and we wanted to give them the skills and the confidence and the access to appropriate resources and services to be able to address those challenges. Our young people went for a more visual approach, as you can see by our scaffold. And what that looked like for young people was about having a trio of trusted adults. So in school, in community, in home, they told us often they had a trusted adult. And we know the research says trusted adults make a huge difference. But sometimes just having one wasn't enough if that person left their employment in a school or youth centre, or maybe they didn't have that contact with a certain family member. It's about aspirations for the future, confidence, self-esteem, positive peer networks and stronger family networks. And from the start, we wanted to have a whole family approach because, again, we know we can do some great work in schools and communities, but if young people are experiencing a family approach that is quite poor in terms of mental well-being, then that can counteract some of the good work elsewhere. So in terms of that, we set ourselves some goals. Children and young people, we wanted them to feel confident to discuss feelings and worries with a trusted adult and support their peers. And these, again, were co-produced with young people, parents and all of our partners. Children and young people were able to find and access support when and where they needed it. And I think the when and where were really key, because sometimes young people want to find that stuff for themselves. They don't always want to have to talk to somebody else first. And also where became a big issue because it isn't always about going to certain venues. Sometimes it's about those services being in the places that young people go to. Parents, they wanted to be confident and appropriately supporting their young people's emotional well-being. And parents told us, mental health can seem like a scary topic. They wanted to get it right. We know parenting can be a challenging job. So it was, how do we support them in that? And then around staff, that everyone working with young people could identify emotional health issues early and provide effective support for children and young people. And again, staff told us they had a lot of worries. Were they going to make it worse? Were they going to get it right? And there's no point telling children and young people to find a trusted adult if those trusted adults then don't have that confidence to have the discussion. And we know children and young people don't always pick the most obvious suspects to us. So they may not go to a school nurse, or they may not choose someone who's had mental health training. And it's fair to say there was limited mental health training when we started this journey for non mental health practitioners. So a good example is we have a local man who runs a young people's fishing club, and he's been on our mental health training because young people trust him and they talk to him. So it was about looking at a really broad range approach to that training. And then about quick access to targeted interventions, which reduce the need for specialist and clinical services. We know waiting lists were an issue in CAMHS, and we were firmly of the belief that if we could see young people earlier, then we could reduce those waiting lists, and also those children who needed a specialist mental health service could also then get the service they needed sooner. So throughout all of this, co-production has been absolutely essential, and co-production is a journey. So it's not about just consulting at the start. We have ongoing processes and systems where we have ongoing dialogue. For some young people, they just want to tell us their thoughts, but some really want to get involved and develop things with us. So our young people have worked with us to develop a number of roles, from co-facilitator to help deliver actual sessions to young people, to be a consultant, to visit youth centres and events and see what the issues are for young people so they can feed them back, because young people often will tell other young people things that they may not want to share with adults. Interview panel members, so when we're recruiting staff, we get young people's views on if they feel that they would be a good worker. Events workers, funding panel members. We've had young people help in terms of commissioning and also running small grant programmes. A planning rep, so all of our volunteers who help us co-produce, they elected one of their own to come to meetings to plan the next steps for Headstart and be a sort of conduit, because you can't always have 70 young people in every meeting, lovely though it would be. Young evaluators and mystery shoppers, so helping us with our whole school approach in terms of making sure that young people have a voice in what works well and what needs to be improved. And campaigners, co-producing mental health campaigns by young people for young people. And all of those young people are trained and supported, and some of them been with us throughout the journey, others have joined at various parts, and their input has been valuable all the way through. In terms of other co-production partners, we have a very active Hull Young People's Parliament, who often call me and ask me to come and speak about things, or they pass resolutions and I need to help them then put them in place. And they were one of the first places that raised the need for better training for school staff and youth workers around mental health awareness, to support those staff in supporting them. We co-produce things with parents, and these aren't necessarily parents or young people who've been in services, although some are, because we want a broad range of input. Schools, and for Hull that means academies, because I think all bar 2 of our schools are academies and the others are on the journey. Early help services, health services, and our voluntary and community sector. So at a universal level, what we aim to achieve, one of the first things was a citywide approach to personal social health education. Having previously done a lot of work on leading on the teenage pregnancy strategy, there was a clear importance on consistent information and skills being given to young people across the city in a spiral curriculum format, through primary, through secondary, to help them have that knowledge and skills and confidence to talk about things that worried them, to know how to, identify a trusted adult, and also to support each other and then access services if they needed them. So we started on the journey with, we looked at a number of different options, and some schools trialled them for us, and our schools voted with their feet that they wanted the Jigsaw PSHE programme. So we've now rolled that out across schools in Hull to provide, and we started that in 2000. We piloted it in 2016 to 18, and we now have it across all the schools. And we're also working to develop add-on packs for our special schools, and we've developed a pack for our sixth form to complement the Jigsaw programme so that it is a citywide approach. That helps set us in really good stead for statutory relationship, sex and health education, because it's mapped against all the Ofsted criteria and is compliant with all of that. And the feedback from young people and schools is that it's a really good package, and we provided them with training on doing that. And for us, it was about making sure we got this right for schools, because it had to be a tool that they found worked, not just one we recommended. Implementing and embedding a whole organisational approach, the DfE and public health guidance, which I think goes back to about 2015 or 17, on a whole school approach. We broadened to include other organisations. So I have schools leads and a community lead who work with organisations to do a self-assessment against the criteria, to look at their organisational approach and against the criteria in the Public Health England document. And then we have participation and co-production workers who go into those settings, they train up young people, they get feedback, they run mystery shopping scenarios, and that includes in schools and primaries, and that's been a learning curve, but we've had great input from young people, and the schools have really valued it. Because for us, it isn't just about an organisation saying we're doing good things, it's about the young people in those organisations saying what really works in practice, and also what needs improving. So those young people then make recommendations, and the organisation can only get the Head Start Hallmark of Excellence, which is the award for the whole organisational approach, if they've taken that feedback on board and looked at how they can improve it. We've got multi-agency training at 4 levels. So we have some training at a respond level that gives workers the ability to respond to information. So we have youth mental health first aid light and other things like that. We then had training at an initiate level, and that was about workers being more confident to initiate conversations, not just wait to be asked for information. We then had intervene. So that was about supporting organisations to do their own interventions at a low level, because not everybody needs a referral to a service. And actually some young people wanted it from the services they knew and trusted. And then we had influence, because young people didn't like it being called leadership. And that links to things like the senior leaders in schools, but also in community. And we're also looking, our next step is around training for governors, because we feel that all schools, as well as having mental health senior leadership teams around mental health, need to have governor support on that. Young people's led campaigns, and I'll come on to that a bit more in a minute. But that was about young people from the start telling us what campaigns they felt were important, helping them design them with us, us explaining budgets to them, so them truly co-producing it, and those campaigns being truly reflective of what young people needed. We needed to have a good digital offer, so we co-produced a website with young people, the howareyouFeeling.org.uk, and that's not just for Head Start, it's a portal to a whole range of services, mental health, but also wider services like sexual health and drugs and alcohol, because young people felt they were important too. It also has a lot of self-care resources, and I've put the link in the slide, and I really encourage people to have a look at that site. It has a young people section, a parent section, and a professional section. Young people told us they didn't always want everything to need a referral. One young person said to me, I'm talking about my problems and somebody's filling the form in. Sometimes I just need to be listened to and have somebody say that sounds really difficult, and a bit of empathy. So Turn to Us is a project with youth workers who go into schools on a lunchtime and are there for sort of pop and chat, brief intervention sessions, but can also offer follow-ups in youth centres if the young person needs a bit more of a discussion. And then if a referral is needed, they're equipped to help them progress into another service. And for some young people, holidays were quite isolating. They lived in other parts of the city to their friends in school and couldn't always get to see them. So play ranger sessions work in parks and other outdoor spaces in the holidays to help build peer networks and support young people's emotional wellbeing through play. So what does that look like in terms of impact? So our Jigsaw PSHE is now reaching over 41,000 young people per annum. And again, that's about consistency of approach, but also supporting school staff to make sure they've got a comprehensive package. We didn't want all 97 schools developing their own packs. That's a lot of work. And schools didn't want to have to do that, but they did want a package that met their needs, and this is the one they felt achieved that. Workforce development training. In the last year, we trained 385 members of staff from a range of settings, and that training achieves roughly that number each year. So since the programme started, we've trained well over 1,000 staff. The How Are You Feeling website gets almost 8,000 unique visitors a quarter, and and 15,800 site views, because some young people look at different parts of it. As I mentioned, we're working to the schools and community organisations Mark of Excellence, the whole organisation approach. And that's been a really interesting journey. We've worked with our special schools to adapt that so the pupils in special schools can also make sure they have input in the same way as mainstream schools. And schools have really embraced it because we've mapped it against the Ofsted criteria. They really feel it helps in terms of being able to evidence for Ofsted the young people's voice, and also that they're working towards that whole school approach. We've had a range of campaigns on issues such as bullying, transition, and that was transition from primary to secondary, and also secondary into education, employment and training, exam stress, online safety and suicide prevention, which is our You Are Not Alone campaign. Some of them were used YouTube films, some used top tips postcards, and the Suicide Outside Prevention campaign actually had a soundscape in locations across the city where young people had said they go when they are feeling that they may be at risk of taking their own life, with positive messages and also how to access support. Turn to us drop-ins have supported just over 4,000 young people a year in secondary schools. And again, that reduces the pressure on targeted early help and also specialist services. Sometimes young people just need people to talk to. They don't always need a longer term intervention. And the play ranges support 1,300 young people in holiday activities a year. For our targeted and early help services, so this is where a referral would be needed, we have a range of services. We have young people's peer mentoring, and all of these, unless they're specifically named, such as the school-based group work, are offered in school or community because young people told us they needed those options. So young people's peer mentoring, where we train young people and they can get a recognised national qualification in mentoring to mentor their peers. School-based and community-based group work, counselling and resilience coaching. For those of you not familiar with resilience coaching, it's for young people who need slightly more intensive one-to-one support than a peer mentor could offer, but for whom counselling is perhaps not the right intervention. Uses a lot of motivational interviewing, managing anxiety techniques, things like that. And then our support for parents and carers. As I said, we were really keen this was a whole family approach. So we have parent peer mentoring because parents told us sometimes they're quite socially isolated and don't have good support networks. Group work for parents, and then support for parents of children with additional needs. And young people can be getting a service, a parent can be getting a service, or either or. It's not a requirement for the child to have a service for the parent to get a service, or vice versa. So in terms of impact, I won't go through all the individual numbers, but we provide interventions on an annual basis to 1,538 young people, and obviously that's made an impact on waiting times for low mood and anxiety at a specialist level, because otherwise these young people would have been waiting, things would have been escalating, and they would have all ended up in a specialist service, or at least needing to be triaged and assessed by a specialist service, which in itself can take time. The different levels of interventions are not necessarily reflective of the success of the project, as they're all commissioned slightly differently with different targets. But as you can see, there's really good take-up of those services across the board. We use the MyStart to measure impact, because I was really clear at the start of this, it's not just about numbers in and numbers out, it's also about did we make a difference. For those of you not familiar with the Outcome Star, it's a very young person friendly tool, and it was young people who, when we piloted different methods of evaluating, they and their families really liked this. It didn't feel threatening, it felt something they could use. And the inner line this is for the whole of those targeted services, but you can run it by project, by age, by gender, different things like that. And the inner circle of blue is where they start, and the outer circle is where they get to, and it measures those different topics, as would be expected in projects that aim to support young people around emotional well-being. Things like feelings and behaviours, confidence and self-esteem are some of the ones where we see the most impact. Things like where you live, we don't necessarily expect to have a huge impact, but that can be about, them feeling more safe in their community, not feeling bullied, things like that. What we were pleased to see was an improvement in education and learning. Now, that wasn't necessarily about educational attainment and attendance, but it was about young people feeling more able to engage in school, or more able to attend. The kind of issues that we deal with in those services are things like emotional regulation, anxiety and stress, and these are the issues that the presenting issue that young people get referred for. It doesn't necessarily mean other issues don't come out while they're there. Bereavement, separation and loss, body image and self-image, boundaries and behaviours, bullying, confidence, self-esteem, depression, low mood, feeling withdrawn. We've had young people referred where domestic violence has impacted on their lives, family relationships and breakdowns, feelings and emotional difficulties, peer networks, relationships, social isolation, risk-taking behaviours, self-harm, transition, engagement in school and attendance, and trauma. So in terms of the parent support, we support annually 685 parents and carers. And again, the figures are there for each project that I mentioned earlier. And again, we use a similar star. This is the family star, which is aimed at parenting interventions. So again, we see improvement on emotional well-being, social networks, boundaries and behaviours, and family routine, which are all things that parents often tell us are the big issues that impact on family emotional well-being. But we also see improvements on some of those other things like education and learning. So again, that's about a family as a whole feeling more able to engage in education and learning. And the kind of issues that parents present on is parents' emotional difficulties, family relationship, family breakdown, parenting skills, family support, general support, coping strategies, parents' mental health, and understanding autism. We have a small number of other measures because at the end of interventions, when they're leaving the service, we also like to know did they overall feel things were improving. And these are across all of those services. We tried to have one set of indicators for all of the services, which I think has really helped in showing the impact overall of the programme. So improvement on presenting issue, improved confidence, improved resilience, improved peer networks, stronger family networks, an additional protective factor because all of this work was based very much on the protective factors and risk factors and improving protective factors, reducing those risk factors. And we also asked them if they knew someone who needed a service, a friend or a family member, would they recommend it? The threshold we set for all the services was 75%. And as you can see, all of our responses are in the 90s. There's a couple of the parents ones that are lower. Improved peer networks. For some parents, it's quite difficult to improve that, and some of the issues are much wider than the projects can address. Although we do obviously refer into other services if wider support is needed. And stronger family networks was also one where perhaps some parents felt it hadn't improved as much as they wanted it to. But again, families, as we know, can be quite complex, and it's not always one service that can support them to improve that. So I guess I wanted to spend some time on the keys to success in this because this has been a long journey. I think one of the key things is ongoing co-production with children, young people, partners and parents. So we've not just set up these services and let them run, we've continued to adapt them, and in every adaptation we've done consultation. So a good example would be young people's peer mentoring. Originally it was in secondary schools and supported young people in secondary schools. We extended that to a community offer based on consultation with young people, but we also dropped it down into transition, and it's now part of our citywide transition plan where young people who primaries identify who are likely to struggle with transition and be very stressed by it or be anxious or other factors, they meet their peer mentor before they go to secondary, so they've already built that relationship. so that then when they move to secondary, they've already got one peer who they can link with. And I think I can't emphasize this enough. It needs to be an ongoing process. Ongoing test and learn, as I've said, adapting to meet need, and certainly I'll come on to some stuff about COVID, and nothing has helped us adapt more than COVID. So again, it is about continuing to look at that learning and having those honest dialogues about, has it worked as much as we hoped? Do we need to still make changes? But also building that into a regular cycle so that we do tend to do a sort of annual review, because if there's too many changes, it can become confusing as to what's actually the offer. Having a core team. So when we set this up, we were really clear that to deliver some kind of system change across the city, we needed more than just services. And the core team are policy and practice officers who work with education. We have two that are schools leads and one who focuses specifically on PSHE. We also have a community lead who works with our VCS and other partners. We have three young people's engagement workers, and we have comms and marketing. And what this was about was really embedding things in the system. So it's really great to have additional services who can meet need, but it's also about those changes at that universal level I referred to, and working in partnership with. So things like, schools having a emotional wellbeing policy, working with schools to develop that, sharing policies between schools so that we have a citywide approach, so that there's not duplication of work going on, and really looking to embed the cultural change. And I think I got a really good example of that from a school recently who, when we first started, there were concerns that are you trying to make all school staff psychologists and things like that? And we can't be mental health workers as well. And I had a conversation with a senior leader before lockdown, and there's a real recognition now that we can't improve educational attainment and attendance unless we improve emotional well-being. So delivering that kind of cultural change where it becomes everybody's business needs a team to do that. It can't just be down to the projects, and that's about having the right expertise. We developed the Headstart checklist, which was one referral form and one consent form for all of those services I referred to earlier, so all of the targeted and early help. Schools and other organisations told us it could be confusing with a plethora of services. Could they find the right form? They wanted one criteria, one consistent approach. And that's really helped in terms of reducing the number of times families have to tell their story. So if a school, for example, is referring, they work through the checklist, which looks at risk factors, protective factors, a number of key factors around which service might be appropriate. And then the form goes to whichever, in discussion with the young person and parents, to the service that they feel is most appropriate for them. The should it get to a service and then after further discussion with the young people, it's decided maybe that service isn't the right one for them, they don't have to start again. They don't have to ring a different number. They don't have to fill another form in. That service would talk to the other service, and basically an agreement would be made and the data would be shared. And what that's done is we looked at, if we had a form for each of the services, we'd probably have 80 pages, and we've got it down to 6. So obviously that really helps. We see that in terms of the quality of referrals, not just the amount, because we have a very low rate of inappropriate referrals. Good links with contact points. So our contact point is our CAMHS front door. Sometimes people go to the CAMHS front door and it's not going to need CAMHS. Again, we wanted to prevent that need for duplication. Now you have to go somewhere else, fill another form in. So we have a system in place with both our contact point and our rehash, our early help and safeguarding hub, to make sure that data, it feels seamless to children and families. And that's been a really positive development. Evidencing impact. So as I said, one performance framework, one tool, and that's been really important because I think it's important to be able to describe the impact of the programme as a whole as well as individual projects. And it also made it much easier from a commissioning point of view to really see the difference we were making across the whole thing. Whereas if everybody has different indicators, it's very hard to compare. Quality impact assessments. Once a year, all of the services doing a quality impact assessment to look at who's accessing their services, who's not. That looks at age, gender, send, ethnicity, and that helps us then target to check with communities who we're not reaching. Do they have what they need? Do they know about services? And do we need to make any further changes to those services to meet those needs? I think another key Sorry
to interrupt, but just you. Hi, Gail. It's Emma from NCB here. Just to
Yep.
let you know, you've just got 2 minutes left.
That's okay.
Great, Gail.
Diversity of delivery, so a range of interventions and partners. So all of those services are delivered by 7 partners delivering 9 services. Helping partners achieve their goals, so helping schools see how this impacts on attendance and attainment and ongoing sustainability. Challenges to overcome. Time. It's a long-term strategy. Results take time. We were really pleased this was 5 years. You can't make these changes in 1 or 2 years. Changing leadership in partner organisations, and that's about making sure that we have it embedded in those organisations so that if leadership change, we have that consistency. Balancing consistency with flexibility and adaptability. Cynicism. Some people were worried this was just yet another project that was going to be foisted upon them. I won't deny academisation isn't a challenge, but I got a quote from a school who said, academisation fragmented us and Headstart is united us, so I think that helps. Don't underestimate the level of need, so we're looking at national prevalence data and are we already meeting that need or is there still more to do? And I think be brave, don't just celebrate successes, but share the learning when things don't work as well. And don't give up. Initially, some schools didn't sign up to this, so we didn't take no, we gathered evidence and we went back to show why it was important, and that helped us get that citywide approach. I probably haven't got time to go through all these adapting to COVID, because we started a bit late, but they are there on the slides. I think because we had a good relationship, we were able to intervene early. We provided life after COVID lesson plans. We adapted the training to deliver it through pre-recorded sessions, additional resources to support transition, and really that continuity of care. So all of our services continue to deliver online or through walk and talk sessions. And we undertook regular surveys to consult with young people to develop a recovery and restoration plan. Any questions?
Hi, Gail. It's Emma here from NCB.
Yeah.
I've popped into the chat that if anyone does have any questions for you, because we're running a bit short on time, that we'll get those to you and you can answer them, and we'll send to everyone with the answers with the slides after the conference has ended.
Yeah, that's absolutely fine, because I appreciate the sessions we've got to move on to one of the next one, and people are welcome to contact me about individual aspects. I mean, I could have presented on several of those aspects in detail just on their own, really, but I think we've got a really good sustained model in Hull. We've got a citywide approach, and all of our partners really feel that they've been part of that journey rather than something that parachuted in. There is one question: have you explored the impact of face-to-face to virtual contacts? So yeah, so some service users have told us they prefer face-to-face. Some have told us they really don't, hence the walk and talk sessions. So what we're doing is looking at a mixed model moving forward, so that we can offer both, and we've made sure our staff on services have had appropriate training and are able to have the right packages to deliver those online aspects.
Lovely, thanks, Gail. There's messages in the chat box just saying what a great presentation this was and what amazing work you're doing. And I think I'd like to say a big thank you to you, Gail, and thanks to everyone for attending. And we'll end the session now so that everyone can pop off to their next one. But thanks a lot, Gail.
No problem.